And
the biggest challenge that we are facing at this point of time is the antimicrobial resistance epidemic. We, as a doctor or professionals, are not able to consider it as an epidemic. We have recently faced a COVID epidemic. Now this is another epidemic. The reason for this is antibiotic resistance. The growing antibiotic resistance is due to the indiscriminate use of antibiotics, and over-the-counter prescriptions, and people are buying medicines from the pharmacy itself without taking prescription. I think we as clinicians also have a larger responsibility to bring awareness about the judicious use of antibiotics, and when required, these antibiotics should be given. Antibiotics should not be prescribed left, right, even for viral infections or symptoms due to non-infectious causes. There are several causes which can also mimic like infection, so we don't really need to buy antibiotics for that. And this is also an important aspect of education. The government and the regulatory authority should also take active interest in bringing awareness about the use of antibiotics. The currently available antibiotics are really, difficult enough to treat the organisms because the resistance, and there is the pipeline of the antibiotic is exhausted. The new antibiotics are going to take a long time. Till that time, what are we going to do? Just use antibiotics judiciously. At the hospital level, the antibiotic stewardship programs are very important. And prevention of infections is also very important. Just using antibiotic is not enough. Hand washing, antibiotic usage, the appropriate dose, appropriate duration of antibiotic, and prompt de-escalation of antibiotics is also very important. 5 to 7 days of antibiotic usage is sufficient. But if we keep using antibiotics for long duration, the bacteria are very smart enough to develop resistance. And there are different mechanisms by which the organisms develop resistance. And there has been a long research going on to understand the mechanism of resistance. There are 4 or 5 mechanisms, but there are many mechanisms which are also adopted by the bacteria to develop the resistance. And we, as a doctor, also has a responsibility to bring the awareness amongst the common population, common man, to understand the importance of use of antibiotics.